you so much for joining me. I'm Sara Maria. I'm the practice representative here at Weiss Chiropractic. And this morning we're going to talk to you a little bit on how to stay young your first 100 years. Usually people kind of look at me a little crazy and say, did she just say her first 100 years? What exactly are you talking about? But it is something, a conversation that needs to be brought up because our life expectancy is doing nothing but growing. Back in the 1900s, life expectancy was only about 49 years. Now that's because there were a lot of infant fatalities and deaths that happened because of these experimental medical procedures that they were doing because we haven't quite found out all that we know today. Luckily, with those experiments and time taken into the medical field, we have been only growing our life expectancy to now. It's about 77.6 as of 1997. And here about 10 years later, it's about in their 80s now, and it's only continuing to grow. Our good friends over at the University of Texas actually predicted that by 2050, over 800,000 Americans will live until they are 100, and some of them will even see 150. I don't know if any of you ever watched the Today Show, but at the end, Willard Smith, sponsored by Smuckers, has this little section where they celebrate those over 100 that are turning over 100 today. Well, they're going to have to change that or completely omit that out of the programming because sooner or later everyone's going to start hitting that age. Just like seeing 80 these days is very, very likely, seeing 100 is becoming more and more possible. So now we have to start thinking how we are going to continue to stay young and not just live until we're 100 and 105, but we want to actually live a quality life, be able to move, work, and play. Now, as of recent, this word, well, ever since I've been born, the word baby boomers kind of has been very prevalent in my life, and that is the first big group of people, the baby boomers, that we've been able to see how these longer lives that we are going to start living will be affecting us. Words like Alzheimer's and dementia weren't household names 20 years ago like they are now. That's not because Alzheimer's just one day appeared in our lives. It's because people are starting to live longer and we're starting to see the ramifications of that. Nowadays, though, because of the growing popularity, there have been preventative measures that we can take and research that's been played out in these fields. And you can do Sudoku, you can do a crossword, you can read, keep your mind sharp, keep agile. There are these preventative measures that we're starting to find out because of this longer age. So although mental disorders are, a factor that we need to consider, the biggest factor in growing older is the lack of musculoskeletal ability. So basically that means the way you move, your mobility function diminishes quite a bit after the age of 50. Now, if I were to say right now that tomorrow at 2 p.m. someone is going to come and rob your house, you probably wouldn't just sit here and say, thanks for the information and continue about your day. You would do everything you could to prevent that and make sure that that doesn't happen. You would maybe call a friend, the police, someone, but you would make sure you would be able to keep everything that you've worked for that next day. You would probably even call into work. Well, I'm here to tell you that life will try and rob you of your mobility. We are living these longer lives, we're working harder, but we're not doing anything to prevent these musculoskeletal disabilities that can come about. Well, if we think about it, at about 65 usually is where we lose most of our range of motion. Well, if our lives are growing longer to about, say, 105, that's 40 years of pain and immobility that we're going to be living in. But it doesn't have to be that way. Luckily, more research is being put into the medical field. It's only growing, it's only booming. And we've seen this highly in the dental field. There are much less cavities in tooth decay than there were 20 years ago because we know to brush our teeth twice a day, we know to floss, we know to use an oral rinse. We have these preventative measures that we've been hearing about since we were little in order to keep our teeth. Same thing goes for wrinkles. As people live longer, sometimes that can show a little, but because of the interest in staying young, there's been a 465% increase in cosmetic procedures going on these days. That's 12 million people a year getting cosmetic procedures, trying to stay young, trying to look young. They say in the society, seeing is believing. So that's why you get your crow's feet filled in, you can get a little plumper in your lips. But if you can't move, if you're sitting in a wheelchair, that will be a much more indicative sign of age than a little bit of crow's feet will be. So, the reason why, wrinkles and the dental are such a boom and such a preventative thought process in our head is because we can see it. So we say, if our spine was on our face, we'd probably do a lot more to take care of it. But, like I said before, you can have the freshest, youngest face, you can have the brightest, whitest teeth, but if you're sitting in a wheelchair, that's going to be a much easier sign, an indication of older age. You want to be able to live your life, not just merely exist in the corner. So that's when preventative care comes in. Luckily, again, with these advancements in medicine, if God forbid you need a new heart, you need a new lung, you lose your arm in an accident at the factory or something, we can get these prostheses, we can get you a new heart, we can get you a whole new set of teeth. That is not true about your spine. So we need to start thinking right here, right now, how we can prevent any spinal damage that we can have. But this isn't necessarily limited to just back pain. Sometimes people think chiropractic, they just think your back. That's true about your neck as well. You can't get another neck. That's also part of your spine. 1 in 3 Americans suffer from neck pain, and 85 out of 100 Americans suffer from back pain. That is a huge amount that would get me thinking, okay, what can I do? How can I prevent this? How can I make sure that I can live as pain-free and as mobile and as agile as I can? You got to start thinking about it now. The key is preventative care. So if we were to look at a scale, and this is a scale of just life taking its course, no preventative measures, we're working as hard as we can, we're playing as hard as we can, we're just living our lives. As you can see, at about 23, that's where our maximum mobility function is. Or, our greatest range of motion, we're invincible, we can do anything at 23. Over here, as you can see, is the percentage of maximum function, or just the way you can move. Down here at the bottom is your age, from 0 to 120, which we will soon get to. And as I said, at about 23 is your maximum function. Then, only about 25 years later, at 50, your percentage has dropped 50% to only about 50%, as opposed to your 100% at 23. From there, at age 50, as you can see, it kind of rapidly plummets down to only 10 years later. That's another 50% decrease at about 25%. Well, if we're living to 100, 120, that's 40 to 60 years of pain and immobility at only 25% and a depleting rate. But luckily, with some preventative care, that can be changed. That's why I'm here to tell you that we can change that scale. It can be moved. Some of you are in here and saying, well, I'm already 50. What about me? Is there anything you can do? And absolutely, there's always something you can do. It's never too late to do the right thing to start to prevent pain and immobility. As you can see here, this red is that same scale. It's just changed color a little bit. But this green is when we factor in preventative care, when we factor in chiropractic, when we start thinking about our spine, our neck. And as you can see, this green line shows that you can gain about 40 years at 75% mobility if we get in and we get started. And then from there, of course, life is ultimately the ruling factor, and it does tend to drop down a little bit, but we can get you more comfortable, we can get you more agile for a lot longer with preventative care. Now, some of you may be thinking, well, that's great. If I was younger, I could have done something about it now, but I'm already 50, I'm already in pain. What about now? Well, like I said, it's never too late to start. And congratulations on starting to get yourself back to wellness. It's a 3-step process, basically, to get you to changing that mobility scale in your life. The key to part of this is to going through all 3 steps of maintenance in order for you to change that mobility scale. Now, the first step in that is pain relief. We have to get you out of pain if you are already in pain. The important thing to note about pain is the last thing to show up, but the first thing to go. So, the cause of this pain are subluxations. It's a big fancy chiropractic word that basically means your vertebrae is out of place. What happens when your vertebrae is misplaced is it's connected by two different nerves. And when that vertebrae shifts, then it pinches on that nerve, and that's where the pain starts sending out. Your nerves start sending out signals to the rest of your body saying, hey, I'm in pain, something's going on, fix me. It's kind of like a kinked hose. When the hose is properly spewed out, the water comes out, the pressure is high, everything's working fine. But when there's a kink in there, then the water pressure is kind of depleted and it's not functioning as properly. That's the very same thing with your nerve. It's kind of like a subluxation, it's kind of like a kink in the hose, and that nerve cannot send out the proper signals because it's pinched, because it is skewed a bit. But the way to fix that is with chiropractic adjustments. Just like kind of you would go and just unkink that hose real quickly and get back to full pressure, the chiropractor comes and will give you a series of adjustments in order to fix that subluxation. We have a couple different procedures, and we call it manipulations, or basically just moving those bones around. You can either do it manually with his hands, or he also has an activator, which is basically a pen, kind of looks like with a little rubber, and it makes some clicks. Those are great for people who are wound kind of tightly like myself. But that is how then we relieve the pain and get you out of that pain. Like I said, pain is the last thing to show up and the first thing to go. So this is the easiest phase to stop at. But I would encourage you not to. Just because you are out of pain does not mean we are finished with our recommendation of care. Now, your body is beautifully adaptive. And because of this, it's a blessing and a curse. So yes, you have been living in this pain, you've been living in this misalignment, and your body, luckily for you, has adapted to it as well. It's gotten used to it and it's allowed you to function. Well, once you're back into placement, after your first visit or first couple visits to the chiropractor, your body then wants to go back to the way it was. So it wants to actually misalign you again. The only way to prevent that is to keep coming and starting into this stabilization phase, which is phase 2 of our 3-step pain relief process. It's kind of like going to the gym. You can't just go to the gym one night, do 50 crunches, wake up in the morning and say, where's my six-pack? You got to keep working at it. You got to train those muscles in order for you to see results. That's the same thing with your spine. Because it's so used to being out of alignment, because you were out of alignment for so long, it takes a little bit in order for it to get used to stabilize itself, to keep you in alignment, and to get used to being in alignment. Once this has all happened and you've come for a little bit and your body's starting to get used to it, saying, okay, this is the way I'm supposed to be living, then we can move into maintenance, which is my favorite, and usually everyone else's favorite. It's the most cost-effective and easy way to be. You can step out of active care and then into maintenance care, and this is where the preventative care, the mobility scale can be changed, excuse me. And you have to get out of pain, you have to get stabilized, you have to get right in order for your mobility scale to be able to change here. And here's when you only have to come in maybe once a month, once every 2 months, just get a quick alignment check, and then you'll be on your way because your body's used to it here. Now I know a lot of you are thinking, I can see your heads turning and saying, I knew it, those chiropractors, they always want you to come back. You know, that's their catch. And you know what, maybe you're right. But let me ask you this. What other medical professional have you ever seen that said never come back? Did you go to the dentist and have the dentist say, don't come back until your teeth fall out? He or she would never do that because it would be a thing of malpractice. They push you towards the right thing, which is preventative care. Much like when you got your first eye examination, probably around the 3rd grade, the eye care professional didn't say, well, your eyes are fine. According to us, you need never bother with the care of your eyes again. Unless, of course, your vision fails completely. Then come back. I think it's time that you were honest. No medical professional can say, ignore your body until there is a problem. And we certainly can't either. No doctor can say, don't ever come back. And we certainly can't either, because it wouldn't be what you need to live your life. Rest assured, we don't want you in here any more than needed. Our adjusting rooms are full as it is. But the purpose of our recommendation of care is to change that mobility scale in your life. We can't promise to keep your teeth pearly white, and we can't promise to take away any wrinkles. But we can enable you to move so you can work, play, and stay young your first 100 years. Now I know I may sound a bit passionate about this, and I am anxious for everyone to experience the benefits of chiropractic care. But let me give you a quick example as to why I'm so passionate and why this really does work. And it involves your whole body, not just your back and your spine. We have some patients here that come in for a variety of different reasons, you know, sciatica, just normal pain, shoulders, some numbness in your shoulders. I personally had that before I came in. I was starting to get some tingling feelings, some numbness in my hands, and I would also start to see stars. Just kind of, I would just open my eyes and see stars. I thought maybe it was a hydration, something like that. Just trying yoga, nothing was really working. Well, I come in, and it turns out my neck is all out of alignment. It's supposed to be curved, and it's kind of in an S form. We start getting here, I was in active care for a little bit, and now just recently moved out and into maintenance care, and I no longer see those stars. I no longer have those numbness and tingling. We have a patient here that we saw that was suffering from vertigo, and that's very hard to live your life with. It halts your complete life. She went to an ENT, she went to a neurologist, she went to her normal medical professional as well, all of them with the conclusion of, well, you're just going to kind of have to live with it. And now I don't blame her, but she didn't accept that answer, so she came in here and sought some external help as well. This is where the stabilization phase comes into, and why it's so important to continue to keep coming and to not just stop once you're out of pain right away. It took her about a year in that stabilization phase to get her body used to being in alignment, to get used to these adjustments, to get working properly. But now, 2 years later, since that year date, she's living completely vertigo-free, thanks to good old holistic chiropractic care, no surgeries, none of that needed. So, right about now, you should be thinking, well, before you quit, you know, I do care about my health and my benefits. What about my family? What about their mobility skill? What about their health? I know I have friends and family that have never heard any of this information before. Is there anything I can do for them? And the answer is absolutely. In fact, it is never too early to start. If you think about the tremendous trauma put on the spine during childbirth, you can see that we actually start our lives with untreated problems sometimes. Obviously, your family needs to come in and get evaluated for a simple, easy, and healthy plan towards living a life of mobility. Luckily, with a little bit of preventative care, we can eliminate much of their pain management later in life. So, for being here and for listening to me, and hopefully learning a little bit today, we are offering an amazing special to show you how much we value preventative care. For $20 today, you can get all of your first day exams included. That means a neurological and orthopedic exam. It is also a maintenance program that you sit down with the doctor and talked about, and he says how he can help you, where we see from here, and what are the next couple steps, as well as any x-rays that you need included, which can be up to 3, depending on your 3 different regions in your back that you need. The great thing about this is we don't keep that $20. We then go and donate that to Love Inc., which I'm sure most of you are familiar with. It's a really great organization we have in this community. So not only would you be benefiting you or potentially your family's life and mobility, but you would also be contributing to the community, which is a great thing that I love. Well, thank you so much for listening. I hope you learned something, but more importantly, I hope you do everything you can to stay young your first 100 years. Thanks. Push it.